Hi, my name is Bihan. Today I'm going to be talking about the Adderall abuse in America. Adderall is a brand name for the prescription medication that combines amphetamine, tetroamphetamine. It's one of the most commonly prescribed stimulant medication for treating ADHD, as well as narcolepsy. It works by increasing the circulating levels of neurotransmitters, such as dopamine and norepinephrine in the brain, which are involved in focus, attention, and impulse control. The history of abuse. Adderall was approved by the US FDA in 1996 to treat ADHD. It has since become one of the most widely prescribed medications for the condition. Its stimulant-like effects, however, also make it a potential target for abuse. Non-medical use of Adderall began to skyrocket in the early 2000s, when adolescents at the high school level and college level began taking the drug to improve their academic performance and to stay up for extended periods of time. Prevalence and epidemiology in the U.S. Adderall abuse is a big problem in the U.S. According to a national survey on drug use and health, millions of individuals in the U.S. misuse prescription stimulants each year, with the highest rates among those aged 18 to 25, including college students. Some studies estimate that 10 to 30% of college students use Adderall without a prescription. In addition to students, there is also a high rate of Adderall misuse among workers and members of other high-stress tech professions. There are documentaries and essays that have discussed how these workers misuse Adderall to improve productivity, cope with long working hours, and stay ahead of the competition. So who are the vulnerable populations? First of all, college students. They often use Adderall to improve academic performance or stay awake. Professionals in high-pressure jobs. They might use Adderall to enhance productivity and concentration. Athletes as well, they might misuse Adderall to improve physical performance. IT workers also would possibly use Adderall to enhance productivity and concentration to stay ahead of the competition. Other individuals seeking cognitive enhancements. This group includes both students and professionals. They use Adderall not for ADHD, but to improve cognition function, such as focus and productivity. Individuals with a history of substance abuse are more likely to misuse Adderall as a part of a pattern of polydrug abuse. So what are the short-term and long-term effects of Adderall? Short-term side effects include increased heart rate and blood pressure, insomnia, anxiety and nervousness, and appetite suppression. Long-term side effects include dependence and addiction, cardiovascular issues, mental health problems such as depression, anxiety, paranoia, and weight loss and malnutrition. During assessments, what are the signs and symptoms of abuse? The signs of symptoms of abuse include unexplained weight loss, insomnia and restlessness, hyperactivity, increased talkativeness, anxiety and irritability, and cardiovascular symptoms such as elevated heart rate. What is the potential for overdose and use as a suicide weapon of choice for Adderall? Adderall overdose can be life-threatening and may result in symptoms such as severe agitation, hallucinations, panic attacks, tachycardia, high blood pressure, seizures, and stroke. Adderall has also been misused as a means to attempt suicide due to its accessibility and potential effects. Below is a sample care plan for a potential client. First of all, we can start with some pharmacological treatment. We can gradually taper off Adderall to prevent withdrawal symptoms. We can also combine the use of medications to manage withdrawal symptoms and co-occurring mental health conditions. Some medications that can help with withdrawal symptoms include antidepressants such as SSRIs, can help manage depression and mood swings associated with withdrawal. Sleep aids, medications such as trazodone or melatonin can help with insomnia during the withdrawal. Beta blockers can help manage physical symptoms such as increased heart rate and hypertension. Non-pharmacological treatment include cognitive behavioral therapy to address the underlying psychological issues and develop coping strategies. Support groups and counseling for peer support and motivation is also recommended. Another significant part of the care plan is patient education. The education should include to educate the patient on the dangers of Adderall abuse, discuss healthy alternatives for managing ADHD or enhancing performance, and also stress the importance of following the prescribed dosage. Other parts of the care plan including referral and follow-up. The referral might include to refer to a therapy specialist in addiction medicine, and also suggest community resources and support groups for ongoing support. Following up including regular monitoring of the patient's progress and adjustment of the treatment plan as needed, and continuous support and encouragement to maintain sobriety. Conclusion. With its growing abuse and rising prevalence among young adults and college students in the U.S., it is important to understand the history, prevalence, risk factors, effects, and consequences of Adderall abuse, as well as the pharmacological and non-pharmacological treatments with patient education and support as a part of the comprehensive care plan. Thank you.